Welcome to this Rehab Management video news brief. I'm Frank Long, Editorial Director of Rehab Management. Sustainability of the outpatient physical therapy clinic has recently been a buzz among the PT community. That's no surprise given what amounts to virtually the near evaporation of insurance reimbursement levels. To help clinics develop survival strategies, the Independent Physical Therapists of California presented its 2015 conference with programming aimed to deliver on the theme, Creating a Sustainable Future for California Physical Therapists. The two-day event attracted more than 100 attendees, some of whom reportedly came from elsewhere around the nation. All gathered to hear a series of thought leaders deliver industry intel about where the PT business is headed and how to prepare. Rehab Management interviewed some of the event speakers to get a sense of the actionable tactics that can help PT clinics face the oncoming challenges. First, we spoke with John Wallace of BMS Practice Solutions. During his address, Wallace, who is a PT himself, explored the level of business technology used within clinics to meet the future of healthcare. Here, Wallace emphasizes how to prepare for the October 1 transition to ICD-10.
It's not to wait to the last second. You can't get ready for this on September 25th. So the first thing you need to do is, if your vendor hasn't reached out to you to tell you what their transition plan is, you should be asking for it. So you know what you need to do if you have to load new software or go to a different URL to access the tools that you'll be using after October 1. The next thing you have to do, especially if you do your own billing, is to reach out to your clearinghouse and see if you need to submit any test claims to them to be sure that you're coding correctly and that they can receive those codes. Then finally, you have to get your therapist used to coding in ICD-10, and you need to start that in August or early September. So for all your new patients starting sometime in August, you should be having your therapist code in both ICD-9 and ICD-10.
Among the contrasts with ICD-9, Wallace points out that ICD-10 allows therapists to communicate clearly and specifically what is wrong with patients. The advantage to that, he says, is when patients are more complex, the clinic can communicate that complexity and expect higher payment because of the increased resources needed to treat the patient. Implementing ICD-10 certainly creates its share of demands, yet there are consequences for not making that implementation.
And for most practices, cash flow is a very sensitive thing. You can't expect to do work today and not get paid for it for 4 or 5 months because your claims get rejected because you submitted in the wrong coding system. So getting paid correctly is going to be contingent on being ready to do this transition October 1. And it's a hard stop on ICD-9 and a hard start on ICD-10.
We also spoke with Timothy Gendreau, revenue strategist at the Gendreau Group, who discussed strategy. Gendreau observes why strategy overall for the profession has fallen short and explains what is behind the theme of his presentation, Hope is not a strategy.
Well, hope is not a strategy is really something that's intended to be a little bit cynical, but it's also intended to shed light on the fact that you can't just wish something would be different and expect it to be different. You can't keep trying the same thing over and over again and expecting a different result. That's the definition of insanity. When you look, the payers are only going to do that which they are allowed to do. And if PTs don't create the data and the processes and the information, and they don't ensure that value is created and delivered and provable, why would the payers do anything other than lower the amount of money PTs get reimbursed just because they can? You have to lay down to be a doormat. This industry has been a doormat. Well, it's a great idea to talk about outcomes and to say outcomes is going to be what we measure everything by. But you can't have the legislation, you can't have the payers, you can't have the providers all saying outcomes is the right thing to do if no one has defined what an outcome is or what it will take to measure an outcome. From my perspective, an outcome has to include a patient history. The outcome has to include patient symptoms. It has to include a diagnosis, prognosis. It has to include a treatment plan. It has to include how the patient did, or from an efficacy perspective of that treatment plan. There has to be time to measure an outcome. And right now, everyone's definition of outcome, and it doesn't matter whether you look at the recent court rulings, they're all saying outcomes is the way to pay and compensate the healthcare world. But if you don't provide the measure, I can tell you, you're going to go pay $100 for gasoline, but I can't tell you how much it costs per whatever, because we haven't defined what a gallon is yet. It doesn't make any sense. And so that's one of the things that has to be elevated well beyond the PT world to the overall healthcare world and bring some awareness. One of the most effective ways to bring this awareness is to help the PTs understand that they aren't creating healthcare outcomes, only functional outcomes. And they need to recognize that what they're doing is merely a subset. It's not saying that what they're doing isn't critically important, it is, but it's a subset of a larger episode of care. That episode of care has to be understood, because then the medical mainstream can recognize more fully how much money can be saved if the PT is brought into the process sooner, possibly before MRIs in certain treatment conditions, etc. And it's not till we get to that point where you've got the PTs working with the medical establishment and the overall providers, will you have sufficient data and sufficient strength to go back to the payers and say, look, you can be saving $4,000 across this group of treatment types if only you involve PT. Therefore, PT should be compensated based on the value that they're actually delivering.
And finally, Paul Gaspar, DPT, President of the Independent Physical Therapists of California, shared his thoughts about why this event is important to the industry and why it is vital to strengthen advocacy efforts that recognize the value of physical therapy.
Well, physical therapists in California and elsewhere are struggling. They're working harder than ever, but having a harder time than ever getting by. We're some of the most valued healthcare professionals for patients, in our opinion, but we're some of the most poorly reimbursed and paid healthcare professionals. We basically don't feel that our needs are being met as practicing physical therapists in California. And what we're here to do today is to identify some strategies in order to figure out why it is that we have this payment problem. And then we're going to come up with some action plans and do a capital fundraising plan to try to implement those strategies. There has not been a strategy revolving around payments or promoting the value of physical therapy practice. Our main associations do a good job on education, government affairs, and other items, but they're really not in a position to be the best advocates for physical therapy payment policy and promoting physical therapist value.
Thank you for joining us. For Rehab Management, I'm Frank Long.